Wall Street, Washington, and Main Street were all focused on health care following the release of the House Republican plan to replace the Affordable Care Act. As we reported last night, insurers will still cover people with pre-existing conditions and allow children to stay on their parents' plans until the age of 26. The big change? Tax credits under the new plan are based on age and get phased out with people with higher incomes. In Obamacare, income and the cost of your insurance determined your tax credit. Bertha Coombs takes a look at the potential winners and losers.
For many of the ACA's winners, older, low-income people, it would mean lower tax credits, while Obamacare's losers, higher-income people, would gain a tax break for insurance, as well as see several taxes on high-income earners to pay for Obamacare repealed.
We need to equalize the tax treatment for the purchase of coverage. Those, again, in the employer-sponsored market, they get a tax benefit for buying health coverage. Those folks that are out there in the individual and small group market, no tax benefit. And that's what this plan would do.
Here's how it would work in a high-cost market like Mobile, Alabama. A 60-year-old earning $20,000 a year now gets $13,200 in exchange subsidies, according to the Kaiser Family Foundation. Earning $40,000 gets you about $10,000 in subsidies. At $60,000, nothing. Under the GOP plan, $20,000 and $40,000 earners would only get $4,000 in tax credits, or 60 to 70% less. Those earning up to $75,000 would now gain $4,000. But insurers would also be allowed to charge 60-year-olds 5 times higher rates than younger people, up from 3 times under Obamacare.
What happens when people can't afford insurance is the only people that tend to buy it are the sicker people. So this is not only going to cover fewer people, but it's actually not going to be good for the risk pool either.
The GOP plan also repeals the ACA employer mandate to provide coverage. But for companies like RHA Health in North Carolina, it's a mixed bag because the so-called Cadillac tax is not repealed, just postponed until 2025.
Within the benefits world, the Cadillac tax has been some sort of kind of mythical creature that may or may not happen. I feel that we already made strides to reduce kind of the value of our plans.
And for now at RHA, they're planning to offer more high-deductible plans no matter what happens in Congress.
It hasn't gotten any cheaper over the past 14 years, okay? The reality is it goes up.
Until the Congressional Budget Office releases its report, there are no official estimates on just how many people could lose coverage under the GOP plan or how much it costs. Bertha Coombs, Nightly Business Report, New York.